Mr. Narashiman, in the first quarter, Novartis posted a strong sales and profit growth above expectations. To what extent are the results influenced by the ongoing Corona crisis?
When you look at Novartis' performance in the first quarter, it was strong operational performance. We had 34% sales growth, 34% core operating income growth, and 13% sales growth. When you remove the approximately $400 million we estimate of forward buying that happened in the system across our full range of products, we still had 9% sales growth and 22% core operating income growth, which is a really excellent performance. Our operations are stable across manufacturing, clinical trials, across our full range of global sites. So we feel very good with where we are, which is why we were able to maintain our full year guidance, assuming healthcare systems return to normal over the course of quarter two.
How will the situation develop in the current and coming quarters? Are you seeing something better?
We continue to believe we have a strong outlook for the year. Of course, we will have more volatility than normal because of the COVID buying impacts. But nonetheless, we believe that for the full year, we can maintain our guidance, which is, continues to be mid to high single digit sales growth, as well as high single digit to low double digit core operating income growth, which again would be an excellent performance given the context of this pandemic. I would say as well, we are continuing to work hard to support healthcare systems, given this challenging time, while we ensure our medicines reach patients.
You mentioned that Novartis doesn't have any problems with the issues in the supply chain, so everything is going according to plan.
When you look at our global supply chain, we've had really minimal disruptions, or any disruptions we've been able to mitigate effectively. It's worth noting we have a lot of redundancy in the supply chain, which allows us to have multiple sources of key products. We maintain over 6 months of inventory on some of our key brands and key medicines, which allows us to withstand any smaller disruptions. So very stable supply operations, working well, no disruptions to delivery of our medicines to patients.
Several Novartis drugs, including the antimalarial hydroxychloroquine, are currently being tested for their efficacy against the coronavirus. Can you give us an update on these studies?
Absolutely. First, we're trying to ensure that there is a high level of data standards being applied to the generation of evidence to determine if these medicines can help patients with COVID-19. We believe you need to run randomized, controlled, appropriately powered clinical studies to ensure you have strong data. So right now, we have 3 main pivotal studies running for a drug called Jakavi, a drug called Ilaris, and a drug called hydroxychloroquine. We expect the data from these studies to read out in the June-July timeframe to give us that first set of evidence. We're also supporting over 13 investigator-initiated programs to enable us to determine if any of our other drugs are having a positive effect. We expect those studies to also read out over the course of the summer. So really, I think it's going to be the summer before we have additional data. But I think we'll have over the whole healthcare industry, hundreds of studies reading out over the summer, which will help us better determine how to treat COVID-19 patients.